Type 2 diabetes, or T2DM, is a disorder in which the body doesn't produce enough insulin or doesn't use it properly. It can profoundly affect quality of life and is very costly both to patients and the healthcare system. Diet, exercise, medication adherence, and tobacco use all affect whether a person develops T2DM and how fast it progresses. So it is concerning that, for example, more than half of Canadians don't eat enough fruit and vegetables, 85% are too inactive, and nearly 20% smoke. Even after a diagnosis, many still don't eat well or exercise, continue to smoke, and don't adhere to prescribed medications or engage in self-management activities. This is a big problem. More than 10 million Canadians have or are at risk for T2DM. What explains these decisions? Is it ignorance? Is it apathy? Or is something else at work? Consider a thought experiment. You must commit to a diet consisting of either healthy or unhealthy foods for a full year. If you choose the latter, it puts you at higher risk of a bout of serious illness, although it doesn't ensure this outcome any more than the alternative guarantees good health. What choice would you make? Would it change your decision if I told you the healthy diet costs twice as much? What if you cook for friends or family who prefer unhealthy foods? How about if you could compensate for poor eating habits by making healthy choices elsewhere? Or if getting sick could affect your ability to work? Lastly, what if healthy eating could cut your chances of becoming ill in half? Now, what if it did so by only 1%? In this image, you'll note that from one angle, the silhouette the shape projects is plainly a square, while from another it's clearly a circle. The moral, of course, is that truth is a matter of perspective. Similarly, I suspect some of your decisions were influenced by the context in which they were made, what you know about yourself and your circumstances. As in the slide, the quality of a health decision depends on where you stand. But it's a big problem, and that decision is one that could make you sick or affect those around you. So what if by changing the context, we could make the healthy choices the best ones? It sounds good in principle, but to do it requires more insight into health-related decision-making than we currently possess. This is precisely the goal of my research. I am modeling how life circumstances affect T2DM outcomes through their impact on individual choices. The model assumes people try to maximize their well-being even as they recognize the risks associated with T2DM and the uncertainty inherent in their decisions. By accounting for patient behavior, we'll be able to better predict the effectiveness of current and emerging T2DM treatments and interventions. This, in turn, will allow us to deploy our scarce healthcare resources in ways that enable millions of Canadians to enjoy longer, healthier, and happier lives. Thank you.